Time now for a closer look at some of the big stories of the week with the Inside Utah Politics panel. This week we have former Speaker of the House Greg Hughes and former State Senator Scott Howell. Gentlemen, great to have you with us. Thanks for being here.
Thanks for the invitation.
You bet. Let's get right into this one. The Church of Jesus Christ of Latter-day Saints coming out, the area presidency making a statement on wearing masks. Greg, let's start with you on this one because a lot of church members felt that the government was impeding on their constitutional rights by making them wear masks. Then all of a sudden, the church weighs in. How's it being received?
It's complicated and it's caused a lot of frustration. So having been a candidate statewide for office, I had the chance and the honor to actually be in every county in the state of Utah. And this topic about masks and how to take smart precautions came up in every interaction. And it is not a foregone conclusion, particularly when you get into rural communities where they don't have COVID-19 is threatening and they don't have the density to look at these precautions the same way. I think the church's letter is the church's letter. If you are a member of the faith, we do sustain our leaders, and I think that's a reality. However, there is a palpable and even I think an expressed frustration from members across the state because it doesn't align with the realities that they're confronting right now. And I think that goes to the whole problem with this virus is I think if we take good information, drives good decisions as our North Star, I think the good information is lacking on all fronts with this virus. It's just, I think it's dangerous times and frustrating times for a lot of people.
Did that letter change the way you have approached this? Are you wearing a mask more now?
I'm a member of the Church of Jesus Christ of Latter-day Saints. I was always going to follow any business or requirement to wear a mask, but I was not supportive of wearing the mask. But I think the letter asks us to be good citizens to do it. I think there's a lot of conflicting information about about wearing the mask, but I'm doing it. That's what I'm doing. But it's hard. It's really it's caused a lot of frustration or a lot of questions that people living across the state of Utah, their lives, their communities don't match the same. It's not all interchangeable, so there's frustration out there.
Okay, this was a letter addressed to all members in the state of Utah. Scott, let's bring you in and get your thoughts on it.
Thank you. I think Greg makes a really good point about the difference in the state and where we have different population sizes. And some of our counties, I don't even think we've had one incident of COVID. Maybe there's one in our least populated. But for me, it's pretty simple. I think we're very fortunate to have a leader of the Church of Jesus Christ of Latter-day Saints as a former physician. And I think he's got a lot of inspiration, number one, but number two, to have that medical background. And when the area presidency, Craig Christensen, sent that out, I think it was to remind us all that the masks are to protect others. And so for me, it was pretty simple. Just hold up the hand and say, okay, I sustained this, and Greg said it earlier.
So do you think that the majority of people are going by that with that same approach, or are some saying, you know what, that doesn't apply to me, I don't need to go by that?
Well, I heard some of those comments in a ward out where my sister is. A family went to it and they got up and left, and their closing comment was, if it doesn't come from the prophet, then I don't think we have to do it. But that doesn't carry it with me. But I think there are people that are really challenging it because they don't know what to believe.
Let me just say this. I've seen some. There have been people that have tried to seek clarification or further correspondence with the area presidency in the state of Utah. The response back was, we want to be good citizens. We were asked by government leaders to issue this request of our members. And so it feels more like under the banner of good citizenship than science or medical efficacy. And so I do think that expression is genuine. I'm not questioning it. But I do think that what's hard about this issue is that the New England Journal of Medicine it's not the National Enquirer, okay? It's the end of May. You can see an article and it says that the efficacy of wearing these masks are minimal out in the public, that even questioned for hospitals. They needed gloves and gowns, and I know a mayor of the town I live in, he could not get tested having one of his members, someone in his staff that had it, if he could not verify that he was part of, around him within 6 feet for longer than 15 minutes, they wouldn't even test him. How do you horizontally impact 3 million plus people telling everyone to wear a mask when you can't even get a test? If you can't verify that you've been closer than 6 feet for over 15 minutes, I mean, that's the stuff I think people are having a hard time with.
Well, let's dig into that a little more because you you do mention conflicting information, and people are wondering where can I turn for the best information. Also, nice reference to the National Enquirer, by the way.
Yeah,
here
yeah.
on
Well,
Sunday.
that's not what it was. I don't think the New England Journal of Medicine's, is that. So I had to tell you.
Let's move into the latest numbers, though. As of recording, we started to see some good numbers in our case count, lowering significantly. But prior to that, we've had some really high cases. Scott, your latest assessment on what we are seeing on the ground as it applies to us in the state of Utah.
Well, I think it's that whole notion of people have just banded together and they wanted to get out so quickly and so fast that they didn't practice any social distancing. We know 6 feet is kind of a magic number. We also know that they didn't wear masks, and some of them were very defiant. And when you saw some of these mob mentality, flash mob mentalities going to grocery stores, it was an upheaval of what people are not agreeing to. And of course we're going to get higher numbers. And Greg's right on one thing about the testing. We should have that much more available for individuals so we can really find out where those numbers are. But when that went over 700, I guess it was a few days ago, that was scary. And today I think well, I'm not sure what it is today, 400 plus. So the deaths continue to go up, and I mean, it's a real virus. That's what I feel. In my heart, I think it's real, and we're just trying to save lives.
Well, look, I don't know what relevance the case count is other than people that are hospitalized or taking the capacity of ICU beds. We have no cure for this virus. We have no immunity to it. You could have stayed inside your house for a year, and on the 13th month, if strangers are all getting together, they're going to get it, because we don't have an immunity to it. So I keep seeing this case count. I find it wholly irrelevant if it's not also about, or only about, our capacity for ICU beds.
Well, that's
what you have to stare at. And look, we're seeing the projection. But you know what, Glenn? I'm telling you, I've been staring at those numbers every single day since I started as a candidate back, well, in March when this thing got crazy. Our capacity's never been at risk. You're seeing it this morning for the first time where it's getting close on the projection side. You would be better, instead of losing $280 million of economic activity in the state of Utah a day going to a code orange, you would be better getting more capacity, more ICU beds. We have agreements with other states where we sent doctors and nurses to other states to help, New York specifically. You got to get that capacity problem issue worked out. Closing down all your businesses, shutting down your schools, creating the backlog of other healthcare needs that people for 4 months have needed to go to hospitals for and not been able to do it. What we're doing right now it's creating more problems and more of a ripple effect the way it's working. You got to just stare at the capacity. The case numbers are not relevant.
Okay, real quick though, I'm not an expert on that, and I don't see firsthand the capacity problems. However, Greg Bell, the CEO of the Utah Hospital Association, is sounding the alarm. He is concerned about capacity being overrun here in the state of Utah. Scott.
Yeah, exactly right. I was going to bring that up. Not only is Greg Bell doing that, but I was going to ask the speaker, don't you wish we'd take use more technology in having the apps that can really do the contact tracing, social distancing, that can help us to verify those numbers and help people to be better understanding about it. And I think that's one aspect of it that we really haven't taken advantage of in the state.
Glenn, the data is confusing to the public. Again, you hear that there's a capacity problem, but there's a stat running around in the state no one wants to talk about, and that is the deaths caused by not being able to be treated for non-essential medical services, not just plastic surgery or even if it is plastic surgery. We're talking cancer treatments. We're talking about pain. We're talking about the blown disc. There are things. We're talking depression. We're talking about addiction issues. People are not being helped where they otherwise would. That is not a public health strategy that is working well for our state.
That is a good point.
I don't know what we think we're trading for here.
That's a good point, and that is something we have addressed. We've had medical professionals come on our shows and say, look, we're seeing people that aren't coming in for the treatments they need, for the tests they need, and so we are trying to get the word out there. Look, you still got to be going to the hospital and taking care of yourself.
Emergency rooms are down 40% out of fear.
Right.
There's nothing healthy about what we're living through. It's actually a healthcare crisis, but it's far beyond this virus. The virus, in fact, if you're just being myopic, I think we're losing in a lot of other areas that we're not
I want to move on to one other thing real quick because we're running out of time. We're scheduled to go back to school here in a couple of weeks. Is that the best idea? We have about 30 seconds each. Scott, let's start with you.
Well, I think everybody wants to get their families back into school. We want to have that edification. We want to have that experience. But the number one concern is let's do it safely. Let's be smart how we do this. And I like the plans where there's some virtual education and there's some face-to-face time. I like how they're social distance, and I think we need to leave this up to the parents to make that decision on what they're going to do. But most importantly, we have to take into account the teachers. That's what I'm concerned about, is what teacher might be in that high risk category that says, I'm not going to go back and do this anymore.
Okay. I got to give Greg, even though he's probably taken up about 3/4 of this
I'm telling you, you got to start
already,
school in the fall.
I'm going to give you the last word.
You got to start school in the fall, and I'm telling you right now, there's a workforce issue here. You can't, there are single parents, there are 2 working parents in a family. You can't, this economy won't work if you don't have kids. These kids, sometimes their only meal, sadly, is at school. You can't force them to wear masks all day.
Okay.
There isn't a group I've ever asked,
Greg made
can you
one
put
good
masks
point.
K through 12
We're gonna have
and
to
have them
end.
wear masks all day?
One good
It's not
point,
gonna
Greg,
happen.
hurry up.
it's about life and death.
Okay. All right. Gentlemen, lively, great conversation. Thanks for being here. Appreciate it.
Not enough
Thank
time.
you.
No time.
We'll be right back.